So Mental Health First Aid is an internationally recognised evidence-based programme that is run across the world in many different countries. Essentially what it does is gives employees the tools and skills to be able to spot the signs that a colleague may be struggling in terms of their mental health. So they may be struggling with anxiety, depression, symptoms of the after effects of trauma, or indeed substance misuse difficulties. And essentially what Mental Health First Aid is doing is giving those employees the tools and skills to spot the signs that something might not quite be right with this employee, to approach them and to have a sensitive and empathic conversation with them, and then most importantly to direct them on to the right support, which might involve professional services. What we're not doing in mental health first aid training is teaching employees to become counsellors or therapists or to diagnose anybody with a mental health problem. We are simply giving them the tools and skills to be able to spot that a colleague may be struggling. The impact of the programme can be really quite profound. Firstly, employees leave with the tools and skills and knowledge and confidence around mental health and having a conversation with somebody that may be struggling. But also this programme really has the ability to save lives. If we're able to spot that a colleague may be struggling and approach them to discuss that, that can ultimately save lives. Of course, given the content and the nature of the topic and the subject, it is a heavy course, and we are discussing things like anxiety and depression and indeed suicidal thoughts. But I think the costs are outweighed massively by the benefits. As I say, this course has the ability to save lives, and therefore it is worth sitting with some discomfort. I think as well, a very skilled facilitator will know when to go to those deeper, heavier places and then bring the group to a lighter place as well. And I think that's just good facilitation.